G'day ladies and gentlemen, this is Fuan Landman from Kiwa, and this is going to be a quick discussion or a short video on the Bestmed Beat 2 product for 2025. So we can start off with the price because that's the hot topic on everybody's lips. So for the network option for a principal member next year, it's going to be 2,581 Rand. And for the no network, in other words, any hospital, it's going to be 2,869 Rand. And then there are the corresponding rates that you will pay in 2025 for an adult dependent and a child dependent. This still stays one of the most affordable saving options on the market with great benefits. So important here is to make sure that which option you're on with Bestmed, whether it's the B2 or the B2N, in other words B2 network. If it's on the network option, make sure that you've got the hospital list, you know where to go for your procedures, because if you don't go to the right hospital, there is going to be a co-payment of 14,364 Rand. So that full, or at least a partial of it, would be covered by a gap cover. So reach out to us and make sure that you've got the correct gap cover in place. It's also important to note that you have to apply for pre-authorizations 14 days in advance. However, if it's an emergency, notify them the next day or as soon as possible. Authorizations are always dependent on clinical protocols, preferred providers, designated service providers, any formularies, funding guidelines, or middle school reference price. So everything is subject to the scheme rules. I'm not going to discuss everything in high detail here, so if there's something that you still have a question about, please reach out to us. But I am going to touch on the changes and some of the stuff that I think is important. So first up, what we've got for next year is this is very nice. Bestmed have added 150 Rand take-home medicine that's charged at or claimed at a retail pharmacy. So in the past, you would have worked with the benefit that's first mentioned, 7 days treatment, and that you had to get at the hospital's dispensary or the hospital's pharmacy. It's not a pharmacy at the hospital, it's literally where the hospital receives its medicine from. So if you didn't get it there, then usually you couldn't have bought it at, like, say, a Clicks or a Dis-Chem, but now there's a small amount, 150 Rand, that you can claim at a retail pharmacy if you missed that. There's also 17,000 Rand available for biological medicine, so that's very cool. Like always, they pay for mental health and chemical or substance abuse, like alcoholism and things like that. And for us to continue this discussion, before I go to the next slide, it's very important for me that you take note of a PMB. So a PMB is a prescribed minimum benefit, and essentially it's the minimum amount of cover that you are legally supposed to receive because you're a paying member of a medical scheme. It covers about 270 conditions, certain chronic illnesses, and then also one of those definitions is if your life or limb is in danger. So I'm going to reference that quite a lot throughout this discussion because there's a lot of things that are only covered at a PMB level, meaning that it's actually kind of excluded, but if your life is in danger or it's part of one of those conditions, then you do have cover for it. So just to take note of that. So organ transplants, stem cell transplants, maxillofacial surgery, and is at PMB level only basically. So it's not something that you can generally go for unless it meets the criteria of a PMB. Maxillofacial surgery is an important one because that is for things like your jaw, and often there's instead of getting a plastic surgeon or a cosmetic surgeon to do a procedure, they get a maxillofacial surgeon who does it through your mouth instead of cutting your skin. So important to take note of that. Dental and oral surgery in and out of hospital, it's at PMB level only at designated service providers and day hospitals. So there's also beneficiaries younger than 7, there's a limit to it, and over 7 dental surgical procedures paid from the savings for procedures performed in doctor's rooms only. So very important to take note of that. Alright, so there's a 95,000 Rand limit on prosthetic devices, and then they've mentioned which ones and what the individual sublimits are over here. So just stuff to take note of. Bestmed is now including dual chamber pacemakers from next year, and also drug-eluting stents, which was not covered previously. So that's kind of cool. Exclusions are joint replacements, so that's a hip, a knee, a shoulder, any of your major joints. And if it's a PMB, in other words, was part of trauma or vehicle accident or something like that, it is covered up to these limits. But do take note that this will not be covered for wear and tear. So if it's due to age or wear and tear or something like that, it's not covered. External prosthetics also not covered unless it's a PMB. And then also breast surgery for the non-affected cancerous breast. So the breast that does not have cancer, also only for PMB provisions. So what's important there is if a doctor wants to do a double mastectomy, primarily it would be for the cancer breast, and then out of pocket for the non-cancerous breast. There are gap covers that will pick up the bill on this, so reach out to us so that we can get you the right gap cover. Same with all of these sub-limits, all of them can be enhanced with a proper gap cover. So reach out to us so that we can help you. If you have a gap cover, let's make sure it's the right gap cover, and then if you don't have a gap cover, it's almost non-negotiable going forward. There are so many changes on medical schemes that you can almost not have a gap cover. There's a limit for orthopedic and medical appliances of 15,000 Rand. Pathology is your blood tests, and radiology is your like x-rays and stuff, that's covered. Big changes on specialized diagnostic imaging. Now, out of hospital, the benefit has been improved. In hospital, the benefit has been reduced. So how this will affect you would be primarily whether it's in or out of hospital. So for next year, there is now an in and out of hospital limit of 22,000 Rand. Now last year, in 2024, this year, 2024, there was just over 6,000 Rand limit available for out of hospital. In hospital, it was unlimited and no co-payments. So in hospital, it's now a little bit of a reduction. Out of hospital, it is better. There's also a 2,100 Rand co-payment per scan. So very important to have a gap cover here. It pays the difference if there was a slight overcharge, if it's a little bit more than 22,000, so that's very important, and it will also pay your co-payment. Just make sure you have a proper gap cover. Cancer is covered in full. Just remember that there's a cancer treatment program or a treatment plan that's released by your oncologist. And depending on how Bestmed funds your cancer on B2, you get an opportunity to upgrade within 30 days. So if it's not covered in full, then you can upgrade to an option where it is covered in full. That can have quite a large financial impact on you, so make sure that you've got a cancer policy or something like that set up somewhere. Dialysis is also covered, confinements, your births, your midwives, all of that's covered. Refractive eye surgery is only at PMB level. Then they have a new day procedure co-payment. So if it's a day procedure and you don't go to a designated service provider, there's a 2,746 Rand co-payment. Again, something that can be settled with a gap cover. You have your international travel insurance, and then also Bestmed has released quite a list of co-payments for 2025. So all of them, in my opinion, are industry related. Most medical schemes charge co-payments on these procedures, and I would not say Bestmed's is higher than what's available in the market. So I think it's a good thing for the scheme to protect themselves a little bit against misuse or stuff that's done frequently. All of this can be settled with a gap cover. So again, chat with us. Gap covers are becoming non-negotiable in the medical scheme world. So just some of them: back and neck surgery, functional nasal and sinus procedures, laparoscopic procedures, colonoscopies, gastroscopies, all of those will now trigger a co-payment with Bestmed. Okay, out of hospital, so B2 is essentially a savings plan, and what you will have is a MSA, a medical savings account, and here you will see this is how they will discuss it. So all of your GP and specialist consultations are paid from your savings account. You have a very nice preventative dentistry benefit on this option. So it's cleaning, fluoride treatment, polishing, scaling. I think we'll discuss it in one of the slides below. But everything else is subject. If there's work done, drilling, fixing, fillings, anything like that, it could come from your savings. Medical apparatus savings account, hearing aid savings account, basically all of it savings account. There's a separate benefit for wound care, which is nice. Glasses savings account, radiology savings account, CT scans we've discussed. Everything else savings account. There's a back and neck preventative program to prevent surgery, so that's also something that's nice if you have back problems. Your medicine is your normal chronic conditions that you can have, and then the rest is basically from your savings account. So you can pause the video here for a second to have a look at what savings conditions are, what chronic conditions are covered, to make sure if we can help you to register for them. I'll mention some of the popular ones: asthma, bipolar, diabetes, epilepsy, hyperlipidemia is cholesterol, hypertension is high blood pressure, and then they also have their PMB chronic conditions, so menopause, endometriosis. Those are things that people claim for quite often. So if you've got any of these conditions, make sure to reach out to us so we can assist you to register for the chronic benefit. The preventative benefit, everybody can have a flu vaccine, so that's very cool. There are pneumonia vaccines for kids under the age of 2, and then Bestmed also identifies high-risk adults, and they'll notify you if you need to go for those immunizations. You have your travel vaccines, that's very cool. Pediatric immunizations, this is a big benefit. In terms of your maternity benefit, those injections can be rather pricey, so that's very cool. Just take note here that it's for the state recommended program. I know there's one or two that's not on the state program, and those you will have to fund by yourself. There's baby growth and development assessments. They do pay for contraceptives. The limit for 2025 is 2,200 Rand. I cannot remember the amount from 2024 from the top of my head, but I think this was slightly reduced. Then we have your UIDs, so you can have one device every 5 years, and then your GP or your gynecologist can put that in. So that's also something. If you don't want to take your contraceptives, you can do a UID. You can have your HPV vaccines. Mammograms are covered over the age of 40 once every 2 years. There are your preventative dentistry, so we'll get you that. Very nice benefit. There's your prostate screening if you're 50 and older, pap smears for 18 and older every 24 months. Here's your preventative dentistry, so very nice benefit. That's your intraoral radiographs that you can have, your scaling and polishing sorry, twice a year, so that's very nice. Fluoride treatment. You also get your visual sealing, so that's also very cool to do for kids to protect their teeth. Really nice thing. And then your spaces. So just know that this is the consultation, and these benefits and anything over and above this will come from your savings account. Maternity benefits: 6 consultations, 2 2D scans, very nice. And then when the baby's born, you get your immunizations for the baby. So those are great benefits. You can also register for Tempo Wellness. You get 1 or 2 face-to-face and a virtual with a biokineticist, and then the same is true for a dietitian. And that's it for the Bestmed Beat 2. I think it's a remarkable product. There have been several changes for 2025, and it's important that you know your product that you're on. It's priced very well in terms of its competitors. Bestmed's a great medical scheme, and if you've got any questions, please reach out to us.